Greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to you this morning. We got a nice video here that you've seen before, but I want to talk about who pays for the orthodontics, and not in dollars and cents or anything, but in the mouth. If you move one group of teeth one way and you use other teeth in the mouth to cause those teeth to move, something pays for it. In other words, the teeth on the other side are the ones that pay the price for that tooth to move. The thing that I want to get across is that you never get anything for nothing. And it's not only just in orthodontics, but it's in life itself. But this rule is there in orthodontics, definitely so. If you make one group of teeth move and you put pressure in the arch, the other side or the other teeth or the things that is the base that doesn't move or moves a little bit and something else moves a lot. So let's pay attention to who is paying the price. So let's get on with this case now. And whoops, my man didn't show up here. What do I hit? All right, here he is. Now this is not a good photograph. It's not in focus, but if you look at this careful, there's the upper front teeth don't actually touch each other. They're slightly apart, and this is why this young man came back in after about 6 months. We put these braces on this young man just on the upper 6 teeth and the lower 6 teeth and his molars back here in the back, and we put 2 little arch wires in there, and he had a closed bite. And we opened this bite with these 2 little arch wires. And let's get into this and show it to you a little more. And what paid for it? Something pays for it. Here are the 2 small arch wires that we used on this gentleman. And they're intruding arch wires. In other words, the upper ones were up above, and you pulled them down, hooked them to the teeth, and then you raised those teeth, and then you brought it up on the lower, and you lowered the lower teeth, and you opened the bite with these 2 little arch wires. Like we were working off of the molars back in this area here, and we had an intruding arch coming up like this on this side. We brought it down and hooked it to these teeth. And when we did, it tightened the spring here, and these teeth were having a slight pressure in pushing them up. Now the thing that makes this work is there's always an equal and opposite force. I don't care who you are or what you're using or anything else, going in the other direction that makes the teeth move. In other words, for these teeth to go up right here, it's harder to intrude than it is to extrude. The molar teeth had to come down with the same identical pressure that was making these go up, was making these molar teeth go down, or trying to make the teeth go down. And now you can only see a little bit of the lower teeth. So the lower teeth were up here. We had another one on the lower arch that came down like this, and over here. We raised it up and hooked it to the teeth. So it was pulling the lower teeth down, and it was pushing the lower molars up. So the lower molars going up, the upper molars going down, and that's who paid the bill for these teeth to go up and these teeth down here to go down. And now we ought to figure that out excuse me, on every case you do. I mean, it doesn't matter where you're trying to move a tooth, there'll be something going in the other direction that's equal to the force going that. And you figure that out, and look who pays the bill, really, in a sense. And it's not only in orthodontics, this is in everything in life. You don't get anything for nothing. And all this junk about we get free medical or free this or free that, and they come on the television and try to, well, sign up for this, it's free, and somebody is paying the bill. I don't care who says they're free. Now let's go on to the next picture, and here the case came in. Now remember in your mind where this came from. Now the upper teeth came down to this line right here. The lower teeth came up to this line, and then let's just show that back again. Let's see. No, I did. There they are. Now I put this rigging on this young man, and for some reason or another, the guy came in, I think about once I adjusted it, and this was back in 1971, I believe, something like that. I don't have it there on the deal, but it was 1970, early in 1970. And this was the kind of a hippie type kind of guy. He's a nice guy, didn't give you any trouble at all. But these teeth up here were down to here, and these were up to this line here. And we opened this guy's bite, and we used the molar teeth to be the counter area where it's going to move. In other words, for these to go up, the molar head tooth had to go down. For these to go down, the molar tooth had to go up. So these molar teeth back here in the back were the things that paid the price to get this to open. And the guy didn't come back in the office. It was about 6 months later he came in. I may have seen him once, I don't remember exactly, but I only put this on and he wanted his teeth straightened. And he came back because he couldn't bite through a hamburger. And that's what brought the guy back in the office. And then we looked at him, and the ladies came in and said, Dr. Wyatt, you need to come back and look at this guy. And so I went back and looked at it, and let's look at what paid the price. To bring these teeth up, it's harder to intrude a tooth into the bone structure than it is to extrude one. So if there had not been something else in here, these molar teeth would have come on down as these teeth went up right there. That is definitely what would happen. And these teeth right here would have come down. No, these are going down, so these would come up and these would go down right here. And they ran into each other right at this point. Now, what paid the price? Why did these teeth not move? This is the reason for you to put this little gadget on the 6-year molars and correct class 2 that somebody wiser than I figured out, and so they've made a few millions of dollars selling this deal. It's on that, but we've had that force for a long time. These teeth are pushed up and held in position by the muscle structure back in here that closes. This guy chewed hard. He pressed on this. So when these teeth tried to move, they were resisted by the chewing effect of this. Now all of this takes place, and a lot of people don't have the foggiest idea why it takes place. So a lot of people today are coming in with these little arch wires that come in, they're folded like this and come down and they come over again, and you hook that arch wire in and it pushes these teeth down and pushes these teeth down, and what pays is the bicuspids in between, and they level the bite that's not near as efficient as the intruding arches, which we looked at this and figured out what caused this to happen, and that's where the intruding wire was born, as far as I was concerned. Now here's a close-up. Those two teeth, this tooth should have been way down here, this one should have been way up here, but they ran into each other right here. They didn't hardly change the angle that the tooth changed a little bit, like the front part would come up and it'd be higher here. The back of the tooth didn't hit much.
I don't know what you mean.
Right here, but it closed into that area. So we'll look at that. Now let's go on to the case. You can see what took place. This is where we came up with the idea of making the intruding arch wire. So we said if these two little wires could open the bite on this man right here, I mean, they were working off the molars here, and they went up and you pull it down, these were coming up, these didn't go anywhere. Down here, or they did a little bit, they kind of cocked back a little bit, and this is hitting hard, and this doesn't hit hardly at all. And now these are coming together right here in this area, and the guy chews a lot, and the muscle structure in here is making these teeth go up, making these teeth go down, and the thing that paid the price was the muscle structure right in here in the patient's mouth, and that guy chewed on that, and it had no effect. So starting at that point, and I think this was, let me find the date on that, was somewhere in here. It's 1971, if I'm not mistaken. Okay, here it is, 4 of 71. We didn't mark his name out, but I don't guess he cares at this point. But 1971, we came up with the idea of the intruding arch. In other words, we're taking these teeth and going down with them. They're right up in the roof of the guy's mouth. The upper teeth went up this way, and the thing that paid the price of these molar teeth back here, except they wouldn't have been able to pay the price if the muscle structure out in here hadn't been pulling them together that way. Now I want us to take this idea to any kind of orthodontic problem that you have. Find out what pays the price, what really ended up paying the price. We've been using this intruding arch wire now for, well, since 71, that'd be about 29, is that right? 29 years plus another 23 years that we're into that now, so that's a long time ago. We started using the intruding arch wire, and we can take this intruding arch wire and cut the dental time of doing the braces down by 2 to 3 months if people will use it right. And don't try to make these little arch wires that start out and circle over and come down again and like that. And you tie them in, and they push down on the molars and down on the anterior part. And what pays the price, it really raise or push the bicuspids together. They do get people open, but not near as efficient as this intruding wire. So I'm going to pass that on to you. So here, let's go ahead and finish the guy up. Here we took this stuff and ran it on and finished doing this young man's case. But from then on, we came up with the intruding arch wire. So I want you to take do the same thing, regardless of what movement that you're causing in the mouth, the teeth to move. There's something on the other end that'll be exactly the same amount of pressure. And what that is going to do to the case is what you have to figure out. So I'm going to say goodbye and thanks for watching, and we're going ahead and take this to the end. I hope you'll subscribe to our dental group. So thank you again.